Hi, I'm Dr. Rhonda Johnson. Today is Friday, May 17, 2024, and today is World Hypertension Day. But first, a question for you. When is the last time you had your blood pressure checked? Why? Because you want to know if your blood pressure is high. Because high blood pressure is the most significant risk factor for heart disease, stroke, kidney problems, and early death worldwide. Now, high blood pressure is when you have a number, when they take your blood pressure, and it's consistently higher than 140 over 90. Now, high blood pressure is known as the silent killer because you can suffer from having high blood pressure without being aware of it. You may not know it, but high blood pressure will be silently causing damage throughout your body. So it's important to check your blood pressure regularly. That's the best way to know if you have high blood pressure, or if you know you have high blood pressure and you're on treatment. It's the only way that you'll know that your blood pressure is being treated adequately. So if you have high blood pressure, make sure you're getting it monitored and also treat it. There are so many medications to treat high blood pressure, and one of those medications, or maybe two of them, might be right for you, and they're very affordable. You just have to take the medication as directed. Now, lifestyle changes help too. Eating a healthy and a low-salt diet, losing weight if you're overweight, trying to be more physically active, and stopping smoking are the main things to try to do. Now, sometimes there are warning signs of high blood pressure, but folks, by the time these appear, the blood pressure is usually very high or it's already caused some damage. Now, some possible signs. I still think it's important for you to know the possible signs that your blood pressure may be high. One is headaches. Frequent headaches can be an early warning sign of high blood pressure. Now, they can be caused by a lot of other things too. Vision changes. As high blood pressure persists over a period of time, it will damage the blood vessels in the eye, and this can lead to vision problems such as blurred vision, double vision, or even a sudden loss of vision. Nosebleeds. Now, this isn't common, but if you're having unexplained nosebleeds, it could be a sign of high blood pressure. Another sign could be shortness of breath, because high blood pressure leads to stress on your heart, and sometimes you can get fluid backed up in the lungs, which causes difficulty breathing. But folks, usually that's because you've had blood pressure that's been too high for a long time. Another sign could be tiredness. If you're tired, persistent fatigue with no reason of all that you know of, that could be a sign of high blood pressure. Another sign could be an irregular heartbeat or a rapid heartbeat known as an arrhythmia. That can be a sign of high blood pressure because, again, your heart is needing to work harder to pump the blood, and it can cause abnormal heart rhythms. And then lastly, if you get your blood drawn and you find that your kidney function is deteriorating, your creatinine is getting high, that could mean that the high blood pressure that you've had has damaged your kidney. Now, folks, I want to say something important. Don't feel ashamed if you have high blood pressure. There are so many reasons why you could have high blood pressure. And for many people, high blood pressure runs in your family. A family history of high blood pressure is a risk factor that you can't control. So control what you can, such as diet, activity, stop smoking, and take your blood pressure medication and monitor your blood pressure on a regular basis. That's my message today. Be well, folks, and take care.